Hello, I'm Dr. Barry Pecos, York Region's Medical Officer of Health. Thank you for continuing to tune in to our COVID-19 video updates. While we're fortunate that many of the most challenging days of the last 2.5 years are behind us, there are new developments regularly, and it's important to share these with you. I'm happy to report that COVID-19 signals in our wastewater continue to show a slow downward trend, and our hospital admissions are stable. They're not low, but hospital admissions are down about half from the peak of several weeks ago. These are good signs as we progress toward the possibility of lower transmission over the summer months. Omicron is present, though, at high levels in the community, so those who are immunocompromised or at risk still need to use some caution. For most others, our high vaccination rates in York Region have been so impactful in decreasing severe illness from contracting the virus. I'm happy to share that we have some new evidence and analysis from studies worldwide, and most importantly, new results from analysis of our Ontario data that make it very clear that the COVID-19 vaccine is a 3-dose vaccine. The 4th dose is certainly important for older individuals and those at higher risk, but for everyone else, whether or not you've had COVID, the evidence shows that the 3rd dose is an immunological sweet spot, where the immune system is stimulated to respond to COVID by the first 2 doses, and then stimulated again to produce a sustained and long-lasting response that protects from infection and, most importantly, provides excellent protection from severe outcomes such as hospitalization and deaths. And it has the added bonus of keeping viral loads low if you do get COVID and decreasing the likelihood that you will pass it on. In communities where everyone has a 3rd dose, this contributes to decreased overall prevalence in the community. So what does this mean for you? It means that if you're an adult age 18 plus or a teen 12 to 17 and have not received your 3rd dose, if you were waiting for the science on safety or the science on the need for the 3rd dose, or if you're otherwise healthy and you had COVID and you don't feel you need it, now we have the evidence and it clearly demonstrates the safety, the effectiveness, and the need for everyone 12 and up to have a 3rd dose. And it's not too late. In fact, the extended interval between doses provides added protection. So now is a great time. There are still many 12 to 60-year-olds in particular in York Region who haven't had their 3rd dose. If you or someone you know is still thinking about their 3rd dose, please do share this new information with them. Regarding children, over 60% of 5 to 11-year-olds in York Region have received 1 dose of vaccine, and most of them received it very early on when it was available, but less than a half have received 2 doses. Evidence from Ontario data, including from the dramatic first Omicron wave that predominantly affected children, shows that 1 dose offers really only modest protection at 15%, but that a 2nd dose bumps that up to 60% protection against infection, even if you've already had COVID. Most importantly, the protection against severe illness goes from 66% after 1 dose to 87% after 2 doses. This is great news. Any parents with 5 to 11-year-old children who are waiting for their 1st or 2nd dose, or were waiting for the evidence on safety or efficacy, please do now come in. Again, now is the time. For those wondering about 3rd doses for 5 to 11-year-olds, the safety and efficacy of a 3rd dose has been studied, and the shot is now available in the United States. It is not yet recommended in Canada, but many parents are hoping that it will be soon. And I think it's reasonable to assume that it will be at some point over the summer, hopefully before school. While COVID illness is generally mild in children 5 to 11, many have become very ill and required hospitalization, and some have had long COVID symptoms despite a mild initial illness. Again, the bottom line is that this vaccine really looks like a 3-dose vaccine for everyone, teens and adults for now, and children likely in the future. Please do come in and get your shot. The 4th dose remains available for those 60 and up, and for those who are immunocompromised. While NACI, the National Advisory Committee on Immunization, has emphasized the need for a 4th dose in those 70 plus and 80 plus, immune senescence is real for over 60s. This means that your immune system just doesn't respond to vaccines or remember them as well as we age. So I recommend a 4th dose for everyone 60 plus. Will you need another dose in the fall? It's possible. And it's also possible we'll have a new bivalent Moderna vaccine by the fall that offers protection from Omicron. However, this is still unknown. York Region Public Health Clinics now have the capacity to fit you in as soon as possible. For anyone, children or adults, who still need their 1st, 2nd, or 3rd dose, you can still walk in and book or receive your vaccine. Anyone 60 years of age and older needing a 4th dose can visit york.ca/COVID-19 vaccine or call Access York at 1-877-464-9675 to book. As we move toward the warmer months and plan much needed summer vacations, it's important to still take care not to spread COVID-19 when it can be prevented. This means taking your COVID-19 symptoms seriously. Stay home when you're sick. Use a rapid antigen test if you have one available. When using a rapid antigen test, swab both your mouth and nose, starting with the inside of your cheeks, followed by the back of your throat or tongue, and then both of your nostrils. With Omicron, you may not get a positive response at the beginning of your illness either, so please take the test again 24 hours later. For instructions on what to do if you test positive or have symptoms, visit york.ca/COVID-19 positive. On another note, I know there's been some concern around cases of monkeypox in Toronto, Montreal, and around the world. I want to reassure those in York Region that the risk of monkeypox to the broad community in York Region is very low. There are several reasons for this. One is that monkeypox is spread mostly by direct contact with an infected individual. It can be transmitted through the air or on items, but less commonly so. Monkeypox comes from the same family of viruses as smallpox, so it is something we're carefully watching. But monkeypox, the type we are dealing with, is typically mild and self-limiting, with severe illness being less common. Most importantly, monkeypox is not a novel virus. We do know something about it, unlike COVID-19, and we actually have a vaccine that is authorized for it, and we have existing antiviral medications. We have access to these vaccines and medications in Ontario, and if cases occur in York Region, which we can likely expect in the next days to weeks, York Region Public Health will act quickly, likely ring vaccinating contacts to prevent illness and to take other measures to prevent transmission. We'll keep you informed as the situation evolves. For now, if you have a rash that seems typical of monkeypox and perhaps have a fever, headache, fatigue, or swollen lymph nodes, and you may have had contact with someone who you are concerned may have had monkeypox or traveled recently, you may want to seek testing. For now, testing can only be done in specialized environments, and likely emergency rooms are the best place to do this. We're hoping to have expanded guidance on testing and hopefully to facilitate more outpatient testing. I want to personally thank everyone for tuning in to our updates weekly and really taking our COVID-19 updates to heart here in York Region. It's because of your continued cooperation and collaboration and the hard work of our public health workforce, our community, and our healthcare partners that we're in a good place COVID-wise. As such, we'll be providing these updates on a bi-weekly basis going forward. While the COVID-19 pandemic is far from over, we're looking forward to a summer that's looking ever more normal, healthy, and positive. I encourage you to visit york.ca/COVID-19 for updates, and I know I'll continue to share details with you as soon as they become available. Finally, I want to leave you with a reminder to always be considerate and have a mask with you or on your face in case you find yourself in a closed space near an immunocompromised individual or around someone who's just uncomfortable in a maskless public space. While it is not required, it is the right thing to do. Please do get your third dose or your fourth dose of vaccine, and I look forward to sharing further updates with you in 2 weeks' time.